So finally, I'd like to share with you the ACVIM method of classifying cardiac disease, and we're going to talk about therapies as we move through that classification scheme. As I mentioned earlier, there is no ACVIM consensus panel on the management of dilated cardiomyopathy. So what I've done is take the evidence and given you what I think would be a relatively well accepted protocol for this treatment. As you can see, we've divided those patients up as those that are asymptomatic, those that have heart failure, and those that have refractory heart failure. The patient who is in A classification, meaning they're prone to disease, but that have no clinical signs whatsoever, we can't identify the disease, we just know they're at risk. We're basically going to educate those clients as to their pet's potential outcomes. If it's a strong suggestion that this dog might develop disease down the road and it's a breed that might warrant nutritional supplementation, for example, a boxer and carnitine or a cocker spaniel and taurine, we might use that drug at this point in time. Once the disease is recognized, B1 prior to cardiac enlargement or after the recognition of cardiac enlargement, the treatment would probably be the same. And that would include an ACE inhibitor, digoxin if atrial fibrillation is present, and conceivably there may be a role for pimobendan. For me, I don't use pimobendan prior to the onset of heart failure, but there is a study in progress which is looking at exactly this, and if those investigators are able to show a benefit, then this would be another time to add pimobendan. Finally, although there are no specific data to support the use of spironolactone in stage B cardiac disease, it would be logical based on the fact that if ACE inhibitors are indicated, then further suppression of the RAS system with spironolactone may be useful. For now, I'd say the evidence supports the use of ACE inhibitors only. Once heart failure has been reached, then furosemide, either intravenously, intramuscularly, or subcutaneously in the hospital, possibly by continuous rate infusion, pimobendan, digoxin only if there's a supraventricular arrhythmia, or if financial considerations preclude the use of pimobendan, ACE inhibitors, spironolactone, oxygen therapy as needed, sedation as needed, and thoraco and abdominocentesis to improve the animal's comfort level and relieve them of respiratory discomfort. Once these animals go home, then we're going to use triple therapy, which is furosemide, ACE inhibitor, and pimobendan. But I also now believe that we have enough data to strongly indicate the use of spironolactone in this point. So chronic stage C would now be a quadruple therapy, in my opinion. For refractory heart failure, our therapy obviously has to become more aggressive in the hospital. We're going to use furosemide intravenously, oftentimes by continuous rate infusion, ACE inhibitors possibly at a higher dosage, spironolactone, pimobendan, oxygen, sometimes ventilatory therapy in referral centers, sedation, anxiolytic therapies such as opiates or acepromazine, and then further reduction in afterload, which acepromazine would help to accomplish. We also might use drugs like nitroprusside. We also might use drugs such as amlodipine here. And then once that patient that's refractory goes home, we're going to use probably higher dosages of furosemide. We're going to continue our ACE inhibitor, possibly at higher dosages than we started the dog on. Spironolactone at 2 milligrams per kilogram once daily, and pimobendan as an inodilator at 0.25 to 0.3 milligrams per kilogram twice daily. In terms of salt restriction, we may start to educate the owners about salt intake early on. In stage B1 and B2, we're going to avoid heavily salted foods. As we move into heart failure, probably using moderate salt restriction, for example, with a senior diet, would be followed by the use of a cardiac diet, a classic cardiac diet with heavy salt restriction in refractory heart failure, particularly if we're having trouble controlling signs of congestion in this dog with dilated cardiomyopathy.